So I'm asking you, yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just.
Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay.
Whew. Quite a public record Kennedy has established for himself there. I'm also not talking about Kennedy's lifelong support for abortion rights that he's now cast aside for a sliver of power within Trump's administration. He was pressed on that at the hearing, too.
So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it.
Yeah, not the best look. Nor was it a good look to repeatedly make claims about Medicaid that prove you don't really understand the program. Like saying that one of its problems is that premiums and deductibles are too high.
Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high.
Yeah, the thing about Medicaid is the vast majority of people pay no premiums or deductibles. That's sort of the whole point. Kennedy's ignorance of the program there was exposed not under questioning from a Democrat, but Republican Bill Cassidy, who admitted out loud that Republicans' plan is to cut Medicaid to pay for tax cuts for the rich and mass deportations. And he wanted to know how RFK will deliver on this.
President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. What thoughts do you have regarding Medicaid reform?
Particularly, Medicaid was originally designed for a target population, the poorest Americans. It's now been dramatically expanded, and the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased.
Can you just kind of take those kind of general principles and apply it to the Medicaid program?
Listen, I think that there are many, many options with telemedicine, with AI right now.
So we're going to pit the poor against each other, never allow them to see a doctor in person, and diagnose them using AI models. Boom, Medicaid solved. And this gets to why Kennedy is such a dang fraud. He correctly identifies how sick the country is, but he doesn't actually believe that healthcare is a human right. He wants to make America healthy again, whatever that means, but he doesn't want to deconstruct the main barriers that stand in the way of people getting healthcare. Here he was under questioning from Bernie Sanders.
Last year, the insurance industry in this country made over $70 billion, while at the same time, 85 million Americans are uninsured or underinsured. Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Healthcare a human right? Is healthcare a human right?
In the way that Free speech is a human right?
Yeah.
I would say it's different because if with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool.
Okay, but what about the child who gets cancer? Or all the folks who get ill by no fault of their own? Should they be financially ruined? Or worse, just condemned to die? Kennedy can't answer that. Even worse, he shills for private health insurers. Yes, he correctly identified how the US spends more than anyone else on healthcare, but with worse results. But he refuses to identify one of the main reasons for it: the overhead and enormous executive salaries at health insurance companies that are inflating medical costs while offering zero value. Listen to this garbage.
Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance.
Oh, yeah. Yeah. Americans love their health insurance. So much so that when a health insurance CEO got shot on the streets of New York City, most people shrugged, and about a quarter of the country agreed that he deserved it. Anyway, both Kennedy and the worm inside his brain are facing a second day of questioning right now in the Senate Health, Education, Labor, and Pensions Committee. Hey, thanks for watching. Hit the subscribe button so you don't miss any of our new videos. Also, if you want to see Means Morning News in its complete form, not just the clips we post here, head on over to Means TV and get access to all our new episodes and our entire backlog, plus tons of other great movies and original TV shows.